Hello, ladies and gentlemen. Today we got a very important subject that I'm going to educate you on because that's what these webinars are all about, educating, improving your knowledge, getting you off of Instagram and TikTok healthcare and stop listening to people who don't know what they're talking about and listen to somebody who's treated the conditions that we're referring to today and has the testimonials to back it up. Yours truly. So the name of our subject today is herbal treatments for chronic kidney conditions. So let's look at the title. First of all, it says herbal. Doesn't say like most of mine dietary guidelines and herbal treatments because we don't have time to cover 4 or 5 common kidney conditions and talk about the diet for each one. And each one of the conditions that I talk about today, and I'm going to talk about nocturnal urination, urinary tract infections, kidney stones, and a few types of kidney failure, like low GFR, where you have a low flow rate, high creatine, where the kidneys are failing, and a combination of both, which would, low GFR would send you right to dialysis. So we're going to talk about a few variations on that, and I'm going to show you what herbs I do to treat all of these conditions. And I'm going to talk about the herbs and a little bit how the herbs work and things like that. So you can hopefully learn, because all of the products I'm talking about only within this year are now available online. But these are very advanced products, particularly when we start talking about the ones for kidney failure. But they're available. That's why I have to educate people, because there's really no way they can just even figure out these products. But I'm putting a lot of information on the website describing how it's used, who it's used for. But you really need this type of education if you have kidney failure to know which products to take, how to take, etc. And like I said, all of the conditions that I mentioned, urinary tract infections, nighttime urination, kidney failure, etc., all have specific diets, and we're not even covering that today. So let's start, and let's first understand that some of these conditions, like urination at night, is not just a natural thing that every elderly woman has naturally. No, it's a health problem, and I'm treating it all the time. And here we have some testimonials right here off of my website, Kabir's Health Clinic, under testimonials, under kidney conditions. And I even say right here, urinary tract infections, nighttime urination, and incontinence are generally a result of congestion, kidney stones, inflammation, such as bacterial infection or depletion in the kidneys. So there are different causes of this nighttime urination, including kidney failure itself becomes a cause. So you really have to diagnose the cause. But you're assuming I really need to see the metabolic panel. I need to make sure your kidneys are not failing, first of all, because that's kidney failure. But most of these cases you see here, that was not the case. And of course, for men, particularly a man over 50 or 60, it just probably is prostate. But here, some testimonials here. No more frequent night visits to the bathroom. She was going 6 to 8 times a night, now once. In fact, if she keep taking the herbs a little bit longer, she would not be going at all. But sometimes people just settle for less and stop at 1 or 2. This guy had some bacterial infection. He's thanking me for, I'm healthier for years, less peeing at night. Another, no more peeing at night. These are long testimonials. I'm just reading this top. But here's one. This is a video testimonial of 2018, the first time I successfully treated kidney failure and got the GFR numbers back up and creatine down. And here we have a video testimonial with the son, the daughter-in-law, all explaining the treatment that took 1 year. This woman, it's a really amazing testimonial. I wish I had more of these old videos. I should have got a lot more in hindsight, but this is probably the greatest one because the woman lost 100 pounds, got off her blood sugar medicine, got off her diabetes medicine, had high blood pressure and kidney failure, and it all recovered. Took her a year, but she was a great patient. And I will always say that you need a good patient for any treatment. I mean, people think that they're just going to get a little bag of herbs from me, it's going to be gone. No, if you're not taking the herbs every single day, if you're not, actively following the diet, then, it's not going to work. This is not just a little pill. So she did the work, and she was a great woman, Maria, and I will never forget her. And this is one of the testimonials I'm most proud of. Here we go. More kidney case. This person was having some kidney symptoms, probably urinating at night, peeing. I don't know. It's in there. This one was talking about kidney stones. He goes into it and says he tried so many things, and my treatment removed the kidney stones and brought his pain down, and then eventually flushed out the kidneys at home. So here's another person. Look, I like this one. Working with Kabir's changed my life, not because she got rid of her arthritis, not because she got rid of her diabetes, not because, she got rid of her high blood sugar, because she's not urinating at night, changed her life. That's what I tell people, that you have to, this urination at night, you need to get rid of it. Let's take a look at the teas that I would use to get rid of it. First of all, if we go to Herbman teas and you go under kidney, bladder conditions, kidney stones, nighttime urination, UTIs, that's all of my kidney formulas. So don't call me on the phone and say, send me something for my kidneys. I don't know. I have a lot of choices to work with. Those are teas and formulas. But let's look at the one. This is the one here that I'll generally give to a person who's urinating at night. We call it kidney bladder detox. It's, it should be called flush, cleanse. But anyway, it got the word detox. And the reason it mentions bladder, because a lot of times this nocturnal urination is bacteria and infections, mild infections in the bladder. And so it cleanses the bladder, improves the kidney function, not enough to reverse kidney failure, but this is really for that nighttime urination. And we can see nettle. Nettle is just the base. Nettle by itself probably isn't hack it. There's a little parsley. It shouldn't really be listed number 2. I think there's more horsetail in here. Horsetail is a diuretic. But the real key herb is tribulus, which in Ayurveda we call gokshura. This is a very, the best herb for the kidneys, and you can see that's used in every tea, every formula. So even though this formula is a Western formula, when you look at nettle, parsley leaf, horsetail, herba ursi, and this is dandelion leaf, by the way. It got cut off on the label. It's not the root, it's the leaf. So for the kidneys, mostly we use leaves and flowers. We don't use roots so much. And gokshura, if you look at it, it's a big thorn. It looks like a thorn. There it is right there. It's a little spiky thorn. So even though this is a Western formula, I use Indian herb gokshura. And there's a lot of information up on the site about how to use it, when to take it, and when to take it. And if it mentions here the other teas, got a few testimonials there. So that's called kidney bladder detox tea. And you drink it in the day. You don't drink it at night because it makes you urinate. Many people said, oh, I'm urinating more. I go, yeah, you're going to urinate more, but you urinate more in the day and then you stop urinating at night. And they go, oh, yeah, I'm urinating less at night, but I'm urinating more in the day. And that's it. That's how it works. Now, it does have herba ursi in it, and herba ursi is the premier herb for urinary tract infections, but it's the second to the last ingredient. There's not much herba ursi in there. When you go over here to the UTI tea, now you see herba ursi as the second ingredients. So this one, because herba ursi is the one fighting the bacterial infection, but you see the horsetail still there, the nettle's still there. These are the dandelion. I don't know. It says root. I think it's leaf. But juniper berries also for the infection. Slippery elm is to coat the urinary tract to help with the pain. And white oak is what you call an astringent. It helps tighten up the bladder in particular to prevent lazy bladder. And oregano is very, very small, also antiviral, antibacterial, and dandelion is more supportive in this case. But here you can see the herba ursi, the juniper berry, and the oregano. This thing takes out urinary tract infections in a couple days. And you can see it's a big bag. It's a big bag, and it will last women a long time. In fact, I've been thinking of just selling it in a smaller bag. It's such a big bag, and you just don't need that much. A lot of other conditions like kidney failure, you might as well have a big bag. I'm thinking of putting it just half that size bag because it's all you really need. It's so effective. But I tell women you should just use half of it to get rid of the urinary tract infection, and then just keep it in case you get the condition in again in the future. Now, here's the kidney stone tea, and you can still see there's some similarities. There's the little spiky Gokshura. Do you see that little spike? They look like thorns. That's Gokshura, also called tribulus. And then horsetail, the diuretic, the dandelion. In this case, we want a little root to break down the stones. And then we have a little bit more demulcents to help pass the stones. That's the marshmallow root, like the last one. But now we put in corn silk as well. This is a known soothing diuretic. It's also demulcent, coating the inside of the urinary tract so the stones can pass. There's another diuretic, parsley. So you have a few diuretics, but the main herb is the gravel root. The gravel root is the known herb for breaking down and dissolving kidney stones. So you still pass them. They just get smaller, and as they're breaking down, they're not as sharp. And the lemon peel also has that citrus aspect. And urinary conditions and kidney stones do very good with teas, because most herbs like joint pain and a lot of herbs, they're going to work much better in powder than a tea, because a tea is going to urinate a lot of it out. But when you're trying to treat the kidneys or the bladder or the urinary tract, you have to put it in liquid. You just can't shoot it down after the meal. All these teas have to go in between meals, and you have to drink the whole cup. You can't just sip it, because you're trying to get the tea and flush it through your whole system. So all of these that I mentioned need to be gulped down in large amounts. And then if you have a more serious condition, then you can add the formulas along with it. This is our kidney health tea we use for just restoring the kidneys. This is more like for urinary tract. Kidney failure. See, when kidneys are failing. It's got the Gokshura again. See, they all have the Gokshura. They all have the horsetail. And they almost all of them have marshmallow root. This one's got this corn silk as well. But we have some additional herbs here that are restorative, restoring the kidneys. Ashwagandha and echinacea, nutritional, moringa. So it's kind of more a kidney restorer, so we use it a lot for kidney failure. But if there's a lot of swelling and water retention, then I'd rather do this one. This is a much stronger diuretic, and it flush out get the swelling down. But once the swelling's down, and particularly when the kidneys are getting better, I will flip over to kidney health tea. So now we have two formulas that are stronger than the teas. And when the condition's serious, I put the formulas in the teas. Gokshura is an Indian herb. The Western herb is tribulus. But you can see it's in all these formulas. It's a premier herb for the kidneys. So we have formulas. The formulas are much better. They're more powerful. This one is particularly when there's inflammation and burning. So if you come to me and you say, oh, I got burning in the urine, not just am I urinating, I'm burning, or even if there's blood. See, pitta means heat, burning. So this is a Ayurveda formula. But look, same first herb is Gokshura again. It's just in powder form. And now we have sandalwood as a cooling herb. Musta is another cooling herb that's used to often weight loss and helping flow and blockages. And Varundi is one of the best herbs for the kidneys. It's a very strong diuretic. And this is a formula called Chandraprava. Chandraprava has 27 herbs. So this is what you call formula in a formula. It's a very advanced formula. So this, and if you go to an Indian doctor and you say you have burning in the urine, he may only give you Chandraprava. That's it. But here this is really Chandraprava plus, because Chandraprava is probably 50% of this. We put a little Gokshura in it. We put a more diuretic in it, and the sandalwood is cooling and good for the burning. And see, it says right here, you can take it with other UTI tea, other teas like the UTI tea or the kidney detox tea. And it says right there, strain and drink quickly to flush out the urinary system. Only take in the day, not the night. So this is, so many people have burning urination. So I'll give them this tea and then maybe one this formula, or if there's a urinary tract infection, I'll do the UTI tea. Now, if we move on, we got this one, kidney flow formula. This is when the GFR, this is the flow rate through the kidneys. E means estimated. In fact, many doctors and they tell me that the E, once you see the E, then that number's not very accurate. It means it's been estimated, not actually measured your flow rate. But it's a little more complicated to get your actual flow rate, that you have to stay in the hospital longer and drink liquids and measure how much is coming out and things like that. So this is your GFR. This is your flow rate through the kidneys. And you should really be at 90, 100%. And if you're 90 or 100%, you're not urinating at night. You don't have any blockages. But once you get around, a lot of people can be at 40 and 50 and they don't do anything about it because but that's not a good sign. You're not going in the right direction. That's the time to come see me, or at least try these herbs. Probably by buying the herb, it may be hard for you to reverse it on your own because there's other factors, and this diet's very important. But you probably could put a brakes on it just by buying these herbs, this flow rate. And you see the people with this poor flow when it gets around 30. One of the signs and symptoms is that they're having trouble urinating. You feel like you're urinating, then you go to urinate, nothing comes out. And you're standing there for a man, you're standing there for a woman, you're sitting there, and you have to relax and relax. I mean, the people told me how it is. And then slowly it comes out, then it dribbles. I always ask the men, how's the flow? Can you still shoot against the wall? And they go, no way. It's like straight down and dripping. So that's a type of blockage right there. They don't have good flow. So, sometimes they don't have time to go in and get tested again. So I have to ask them, how's the flow? How far back could you stand from the toilet? Things like that. How long does it take to start and get going? And they said, oh, big improvement. Before, I'd be standing there and have to relax. And even men would sit on the toilet just waiting. And then when they do this formula in particular, it gets going. Now, see, again, it says gulp it down, don't sip it, and put a couple teaspoons in 10, 12 ounces of warm water, or even better, one of the teas, kidney health tea or the kidney detox tea. And you got to take it between meals. You can't mix it with food. See, it's the old saying, devil's in the details. And a lot of people, they can have the right herbs and not take them the right way. And none of these kidney herbs are going to work in capsules, because or with food. They've got to be in a tea, flushing out. When we're using the tea sometimes, or just nettle, or some of these, just like it's called the anupana, the carrier of the herb. So this is the herb, and it's flushing it out. Now here you're going to see, there's the gokshura again, first ingredients, and there's the chandraprava. Chandraprava is the herb used for this condition, the blockages of flow. Chandra means cooling, and then it does have some shilajit in it, and that opens the channels and gets things moving. We also amazingly use chandraprava for pancreatic blockages. So it's used for getting things flowing, not just in your urinary tract. Punarava is a strong diuretic. Varuna is another strong diuretic. Getting water out of the body, getting this flowing, and then shilajit is a little extra. It's probably only a couple percent of shilajit in there, but that really gets things flowing. Now, if you're having kidney failure, say your GFR is down to 30, you get down to 20, you're on dialysis. 30, they're talking about it. 40 or 50, you better start doing something. But people don't. Like I said, they just wait. And that's what the doctor says. Just keep getting it checked, because they have no treatment for it. And by the way, one of the main causes of kidney failure is high blood pressure. And apparently, even you're on the medication and your numbers look okay, you still end up with high blood pressure. There's some people that say that it's ACE2 inhibitors themselves, the blood pressure medication, that damages your kidneys. But some doctors that are good friends of mine say, no, It's not the medication per se, even though everybody acknowledges that all medication damages your kidneys. The more medication you're taking, the greater probability you have kidney failure. But it's really the high blood pressure. Even though your numbers are good, the high blood pressure is damaging your kidneys. I had a very respected doctor that I respect a lot who's retired. And I asked him, how high does the blood pressure have to go to start damaging the kidneys? Now, in my mind, I was thinking, okay, maybe 180, 200 for sure. This guy told me 140. Like, you're telling me you hit 140, 150 with your blood pressure? This is damaging your kidneys? He goes, oh, yeah. And see, what happens is that people have high blood pressure. They don't it's really high, 180, 200. They get on a few blood pressure meds, so they get it down to 130, which, they're not going to have a stroke and die, but it's still damaging their kidneys. I think it's kind of the combination of the two. It's the constant pressure at the 130s and the 140s and the peaks, plus the medication, because everybody knows, the reason your kidneys are failing is they can't get the toxins out fast enough out of your blood. That's why you can die, because it's removing these toxins so fast. And when you're taking like 5 or 6 meds, that's mostly the type of people that have kidney failure. The other type is people on a high protein diet. We get a lot of keto people, young in their 30s, particularly if they're doing keto diet or carnivore diet, these extreme high protein diets. And they're also taking protein powders. They take all that extra protein, and that protein, of course, is the waste product from the protein is a lot of toxins. One of them is uric acid, but there's more than that. And that uric acid and high toxins creating from this extremely high protein diet damages their kidneys. So I get the two main categories I'm getting people coming to me for. They're doing high protein diets, weightlifters, guys, just keto diet. That's it. No vegetables, no fruits, just high protein and fat all the time. And, they're okay for a few years. I mean, hey, they got some muscles, but their kidneys are failing. And then the other type is a type that's been taking 5 or 6 medications and definitely has a high blood pressure, because even the blood sugar can damage the kidneys. The kidneys are just that sensitive. So the blood sugar harms them, the blood pressure harms them. So that's what they call like a little trifecta of problems. There you got the high blood pressure, you got the high blood sugar, and then you have the kidney failure. You have all three, and that's a big category. And so because the medicines they're taking for it are making it worse. So generally you have to treat the person for the diabetes and get them off the diabetic medicine. Then you have to treat the high blood pressure to get them off the blood pressure medication, because the medications are creating the toxins and burdening the kidneys. So it becomes quite a bit of work. That's why it takes up to a year. Now, I'm saving for last probably the best formula here, and that is Renal Cure. Renal Cure is the one that's improving kidney function. Now, some of these herbs are very hard to find and very rare. So I'm not going to mention them all because they're hard to find. And it says here, improves kidney function. But you see the Varuna, diuretic, Punarava, diuretic, Gokshura, healing. But here's another herb, Kasni, which is related to chicory root. But this is a very healing herb. And Bumamalaki. Bumamalaki is one of the premier herbs for liver problems. And when you start to get kidney failure, you really need to improve the liver. And this particular herb helps get toxins out of liver and out of the kidneys. And it's known to help kidney function as well by removing the toxins, because that's the whole burden. Shirish it's a special herb we use for allergies. Palash, very hard to find. We have to import it from India. Moringa, people know about, and you can see it in the tea. It's a nutritional, supporting the kidneys. There's only a little percent in there. You can't do too much because moringa is very hot. Arpamarga is another very rare Ayurvedic herb that's used for tumors, and it's also helping with blockages and flows. So usually we put the person on this and give them, it's best if taken in the kidney health tea. Remember that one, the kidney health tea, that one. This is for, may give them the tea. That usually I give them 2 bags of the tea and then 1 bag of the renal cure per month. And now if they have the GFR numbers are low too, which is usually the case, sometimes I'll just give them the GFR, this one, the flow one for the beginning, just to get the GFR numbers up. So because that's what's going to send them to dialysis. So I may focus on that one, and I may not even use kidney health tea here. I may use kidney flow tea with the bladder detox to flush them out and get the GFR rate up, number up, because that's the real danger. And then if that number gets better, then I'll move over to the kidney cure. But a lot of times I'm giving it might be 20 kidney failure cases at any one time. And many of them are doing both, the kidney flow and the renal cure. They're just mixing them together. Now, if the creatine is very high, like over 7 or 8, my teacher in India told me you really have to give some more herbs to help the liver and get the uric acid out. So here's a liver formula that I use. See, now most people wouldn't know this is used for kidney failure because it says blood, kidney, liver detox. It's used for a lot of skin conditions, and particularly gout. If you have gout, we use it. But that's because the uric acid, you get the pain in the tubs. And it helps with swelling. But we also use it when the kidneys are more advanced stage, not the flow rate, but the failing. The creatine is over like 6 or 7. We put in some of these liver herbs that are on top of what we're already giving them. So a client with kidney failure could be taking this once a day, maybe just 1 teaspoon at night. It says twice a day after meals, but it could be once a day, depend. And then the renal cure, maybe mixed with the flow, taken inside of either the bladder tea if they're swelling, or in the kidney health tea if the swelling is under control and we're in the later stages of just trying to improve the condition. So, and then of course, diet is a big factor here that cannot be ignored. The diet is very specific for kidney failure. The doctors will just tell you don't have any potassium foods, like no bananas, no avocados, and not some leafy greens. But this is a basically useless diet. I mean, it's true you can't have the high potassium foods, but it's a little confusing because people, they think that's going to cure them. Just like, people think sometimes not having salt is going to bring down their high blood pressure. It's true. Taking salt will create more water retention and swelling and increase the blood pressure, but stopping it doesn't cure you. You just end up with nutritional deficiencies. And same if you over limit your diet, getting out potassium isn't going to stop your kidneys from failing. It's just going to maybe not make it as worse because, then and prevent swelling. If you get really bad swelling, I have another formula for swelling, but that's a bad sign if you have kidney failure and your legs start swelling up. Some of my clients even had to go to the hospital. And so now I'm more cautious. If there's any swelling, I have another formula for swelling, or I leave him on one that's got enough diuretics in it to keep the water out. So this person's drinking a lot of foods there, and we do what's called leaching. I'll tell you the secret here. I'll tell you there is a secret to the diet. It's called leaching the vegetables. So you can still take sweet potatoes, which the doctors tell you don't have, but you have to cut them up real thin, and you could put carrots and even cabbage and other things the doctors tell you not to have. And you just put them in a big bowl, giant pot of water, soak them. Some people say soak them a few hours, but then you cook them and you just pour the water out, and all the potassium goes out with the water, and then you can eat it. So that allows you to eat a lot of foods that you think you couldn't eat. And it just gets rid of all the potassium, even in some foods that the doctor tells you, don't worry about because they have low potassium. This leaching gets it all out, so very, very effective method and then of course there's you have to do a low protein diet. You can't be doing burgers and hamburgers. So I've had to take some guys who were, they loved the keto diet. I had one guy even wrote a book on it, but when he got kidney failure, no, he had to go vegetarian. Yeah, when you get kidney failure, it's serious because nobody wants to go to dialysis, particularly if you're in your 30s. You're late 38 and the doctor's telling you you're going to have to go to dialysis. And, sometimes they check with their doctor. Do you think this high protein diet, eating all this meat all the time and protein powders? And doctor will say, yeah, it's creating the uric acid. That's why you have the gout too. A lot of times they have the gout plus the kidney failure and they're still eating all that meat because, people get convinced their diet is the best diet and things. But I've had people where they had to stop that and you have to do a low protein diet. Most people, it's pretty hard to not get enough protein unless you're just, eating fruit like Steve Jobs was. But, he killed himself because of, he had only fruit and didn't eat enough other foods. And that's how he got pancreatic cancer because too much sweets, too much burden for the pancreas. So you never want to burden your organs. You don't want to burden the pancreas and do the, fruitarian thing like Steve Jobs did and kill yourself. And you don't want to do the all protein and fat, or then you're going to have the kidney failure problems. And you get the liver and gallbladder problems too from all that fatty food. And you don't want to do some extreme vegan diet where you're having almost no protein at all, or you become weak and frail and, your hair falls out, your menstrual cycle stops, your libido drops, and you become weak and no muscles because you've been trying to live off of smoothies and, vegan. So, any extreme diet is a burden to the body, but definitely you have to be very careful with the kidneys. The kidneys are very sensitive. So it's a non-aggravating. Coffee makes it worse. I can't believe how many people or women in particular urinating at night and still drinking coffee. So I gave them the herbs, told them to stop the coffee. Next appointment, I said, how's the urination at night? And they go, well, the herbs helped. No doubt. I felt right away the flow was better. But once I stopped the coffee, that was it. I stopped urinating at night. So that's, you're usually causing it. Coffee is very inflammatory and it's a strong diuretic. So it's like flushing out your kidneys and bladder and irritating it on the way out the door. So if you have a sensitive bladder, or you've had a history of urinary tract infections, then this coffee is just irritating it and making it worse. And that's what a lot of times the bladder is just releasing because there's some infection or irritation. So you can't do hot, generally speaking, for kidney conditions, you can't do hot spices, no chili pepper, no cayenne pepper, no strong spice. You can't do any coffee. That's inflammatory. You can do green tea. You can't even do chocolate. Chocolate's another, over-marketed food that people got convinced is healthy, but it's inflammatory. And a lot of supplements are a big problem too, because these things are just mostly over-the-counter chemicals that, are maybe in small amounts. You're on vacation. You've got nothing else. Take them. But people take them 20, 30 years, ends up some types of kidney stones or result of calcium citrate use for a long time. Magnesium creates lazy colon, lazy bladder. You can also get women who have this, been taking magnesium for a long time. So now their bowels are coming out, but now their urine's coming out too, because it makes all of we call lazy bladder, or lazy colon from too much magnesium. So vitamin supplements are another big problem because they're really, there's a lot of toxins coming out from them because these vitamins are synthetic vitamins, unless you're buying food-based vitamins. Most people don't seem to, but if you buy food-based vitamins, if you go to Amazon and you type food-based magnesium, then you're going to be doing much better than the synthetic ones, magnesium citrate, magnesium calciphate, and the D3, the same thing that they use to kill rats. I mean, you got to be careful. Once your kidneys start failing, you got to get out all these supplements, everything artificial. You got to be having all organic food, no hot spices, no chili peppers, no coffee. Anything is going to bother. You got to take the burden off of the kidneys What are the kidneys doing is they're getting the toxins out of the blood. You can't be consuming more toxins all day long. You're never going to give your kidneys a break. So you give them it doesn't cure them to get on this, to do all these things, but the herbs do the curing. But the diet can, if you don't change the diet, you're not going to make it. I mean, it's just like if you're an insomniac, no matter how much sleeping herbs I give you at night, if you keep drinking the coffee all day long, it's not going to work. So it's the same with the kidneys. It's just not so clear to people, that they've got to stop all these things. A lot of all the supplements, alcohol, coffee, everything. You got to go monk, pure, just home cooked, bland, low protein meals for up to a year. So I'll be honest with you, for those people who are thinking, great, I'm going to treat my kidney failure. I have a lot of people that say, my sister, I had somebody the other day, they were asking me about it. They wanted to, send their sister had kidney failure. And I said, look, when you're talking about a third person that I'm not talking about, here's my questions. 1, are you willing to totally change your diet? 2, can you take herbs morning, evening, and night? And sometimes the answer comes back, no, they're not willing to do it. So I said, don't waste your time then. I mean, what's the point? I mean, you can't help the person, particularly with something as advanced as kidney failure. Now, UTI, okay, just take the tea, get off the sugar for a week and drink the tea. Your UTI is gone. Kidney stones, there's a few dietary things that you need to avoid, and then take the tea for a couple months and flush the stones out, and you're fine. But not kidney failure. You're going to be taking the herbs for 6 months to a year. In fact, you could even be continuing to take them in small amounts after a year. I've had people that kind of recovered, then their numbers got bad. They came back a year later. They bought some more herbs. They improved them again. It's always easier to climb the mountain the second time as they did it the first time. So they know what to do the second time. Give me 3 bags of that. Give me 4 bags of the tea. They know in a way better than me, at least for their body, because they already bought all these herbs for a year. And a lot of the products I showed you, they've tried. So they know, and they'll buy a new batch and they'll go for a month or 2, get their numbers under control, and they don't hear about them for a while. But if you've had any health condition in your life, like, whatever it is, high blood pressure, cholesterol, diabetes, or kidney failure, and then you recover, after me, or taking herbal treatment. Herbs are used for treating all these conditions, not vitamins. Vitamins are just supplements. They're not going to treat any of these conditions, but once you've had it and you've recovered, I always tell people, you better be careful. You don't want to have it reoccur. I mean, it's like any condition. Once you've had it once, your body's susceptible to getting it again. So you're going to have to be careful with all those foods, those that I get you to get off of. Maybe you don't have to be so restrictive for the rest of your life, but you're always gonna have to be careful. And I've had kidney failure clients come back as many as 3 times. Now they know what they did. They go, yeah, I got rid of the beans. I started eating meat. I started having coffee again. So I stopped the coffee. I stopped the beans. Send me the herbs. Thank you very much. They know what to do. But, it'd been better off to just avoid it, the relapse. And don't wait until the numbers are so bad. They're telling you, oh, I've had them call and they've already scheduled for dialysis in a month. So they wait right to the last minute. And sometimes these people have heard about me for a year. They're like some family member telling them to see me, They keep going to the doctor, and the doctor says, well, and then finally they figure out there's nothing they can do. Dialysis or kidney replacement, kidney transplant. That's it. And then you're taking the kidney transplant herbs for the rest of your life, and that's even risky, that whole treatment, and you have to take this immune suppressing drugs for the rest of your life. So kidney transplant's not a good idea. Kidney dialysis is very uncomfortable. They do now have a home version of the dialysis for some cases, and that's supposed to be better. You don't have to go somewhere to do it. You can just kind of do it in your own bed, but it's not pleasant having all your blood pumped out all the time. And it's just basically doing the job of your kidneys. So that's why you see some of these formulas, particularly that last one show, it's called blood liver detox. It's basically a blood cleanser, helping your kidneys do their job. And that's what the herbs are doing. So some people have to keep taking these herbs like a small doses for a long time just to keep helping their kidneys and stay on the diet. Well, I hope, if anything, this helps you realize that these conditions are fully treatable. If you're committed and you're a good patient, and all of the products I showed you are on sale right there at herbmanteas.com, and you can use the coupon code webinar 10 off, and you can get another 10% off. And right now on the website, all of these kidney problems kidney products I showed you, they're all on sale until Sunday. So I should have said that outside the webinar. I forgot, because the sale is going to be over if you're not if you're watching this on YouTube. Sorry about that. But anyway, the discount code will still work. And if you got kidney failure, you're better off to just do an appointment. Let me tell you. I mean, you could start if you want to prevent it. Maybe you can take some of these herbs, but you really should do an appointment for kidney failure. It's too serious of a condition to be messing around with on your own, even with my products. Thank you very much, ladies and gentlemen. I hope this helped you understand the herbal treatments that are available for these chronic kidney conditions. And don't hesitate to contact my office and schedule an introductory appointment where I can evaluate your condition and give you the prognosis of your recovery, and have a discussion with you about your case without charge. Thank you very much, and God bless you all.